That's Dr. Jehu Appiah there. Well, for his part, Presidential Advisor on Health, Dr. Anthony Nsiah-Asare, is assuring that the next NPP government will build new health facilities across the country and upgrade existing ones. The former Director General of the Ghana Health Service maintained President Akufo-Addo is committed to ensuring that no community in the country is without a modern health facility.
To upgrade an existing district hospitals and then finish all existing hospitals, I'm happy to say that Eurojet project, or the 9 projects, we have been able to commission 3 of them, 1 regional hospital at Wa, the district hospital at Kwabenya, and recently His Excellency the President commissioned the district hospital at Tepa. 2 more hospitals are ready for commissioning. We are hoping we'll do it this month, but maybe in early next month. That is Chufopraso is ready, Soko is ready. The others at Konongo and Seria will be ready by the end of the year. The military hospital at Aferi will be ready next month for commissioning. What will be left will be the Salaga one, which we hope to commission it early first quarter of next year. We've also came to meet construction of 10 polyclinics that we completed in Central Region. Another 5 polyclinics in Greater Accra have all been commissioned. And we are now constructing 5 new district hospitals in Sola, Tolon, Sumenya, Bupe, Weta Hospital has also been commissioned recently, and the polyclinic at Bamboy is ongoing. We have begun a process which is going to be one of the biggest hospital infrastructure development in Ghana since it became Ghana, the Agenda 111. We want to put 101 district hospitals in districts without hospitals. 6 regional hospitals in the 6 new regions, a new regional hospital in Western region, and the rehabilitation of Ofia Kwanta Hospital to become a metropolitan hospital for Sekondi Takoradi Metropolis.
And that's Dr. Nsiah-Asare. Let's have a little bit of a conversation on the back of this one. Dr. Emmanuel Aifa is Deputy Country Director of St. Ghana. They are organizers of the events that brought these 2 parties together to discuss our healthcare needs vis-a-vis what they have in their manifestos. Doc, thank you for your time. Good afternoon.
Good afternoon, and thank you for having me. And good afternoon to all your cherished viewers.
So let's start with what you sought to achieve with this program today. What did you set out from the outset to achieve?
Okay, thank you very much. So you agree with me that political party manifesto continue to be a key element of our democratic process as a country, and for that matter, our governance. And so manifestos now are seen as social contract between the citizens and the political parties. And for that matter, even as we are in the electionary year, St. Ghana and our partners, we sought to, first of all, find out from citizens what is it that they expect to be in the political party manifestos in general. But for specifically for today, we're focused on health. You would also know that manifesto commitment are something that mostly citizens expect for the government that actually ends up winning power to commit to. And so it shapes the country's medium-term development strategy. So the discussion today was to give the platform for the 2 main political parties, i.e. NPP and NDC, to, after we've submitted the input from citizens to them and they've launched their manifesto, for them to actually come out clear to tell the public exactly what is it that captured in their respective manifestos. And so for us to look at how committed they will be in prosecuting the agenda if they win power. So that is basically what we sought to do today.
Let me find out. If you look at the NDC's position, it has been to invest in more what they're calling preventive health care. And they are talking about providing free primary health care as well. The NPP, on the other hand, says, look, we need to invest in the infrastructure that opens up the access or widens access to health care. Were you convinced as organizers of this program?
So let me be frank with you that, of course, both parties, in a way, are looking at different approaches to solve the same issue. Of course, the issue is for us to achieve universal health coverage by 2030, as the AGC seeks for every country to do, and Ghana has committed to. In terms of the MPP's agenda 111. I believe that is one of the key things that they are talking about in terms of providing health infrastructure across the districts. I'm fine. It's a very good agenda because the fact is that we need very good district level health infrastructure. But our worry as Ghana and people who are actively working on the ground is that when we went round to solicit views, people were saying that the CHIP, that is the community health planning system, is something that government need to be serious at implementing. Fine, you may build hospitals in the district, but then if somebody is sick, seriously sick, at the community, the rural level, you don't expect the person to travel all the way to the district before the needed healthcare is attained. The fact is that even transportation to such places is an issue. And so we think that yes, it is important, but turn also attention to the CHIP policy and implementation. Issues of CHIP infrastructure, issues about even health commodities at the CHIP compound is something that is bedeviling most of the rural areas. And so that is one thing that is seemingly lost even in both parties, NPP and NDC's manifestos, because we think that that is where the very base of primary health care. Coming to the NDC one, yes, they're talking about free primary health care. The question that someone want to put is that somewhere I think in 2008 or so, they promised one-time premium of the health insurance. The fact is that were they able to prosecute that? All of us know that they were not able to do that. And then you are coming up to tell us about free primary health care. What struck me today was that when the NDC person in charge of health was asked about financing for the free primary health care, he indicated that they are going to use about 1.4 or so billion Ghana cedis yearly to prosecute that agenda. And then the fact is that they said they are also taking that from the oil revenue. Mm-hmm. And when they were asked as to the fact that it's the same source that we are getting the free SHS money from. And so if you are seeking to do that, then the point is that how are we also going to then finance the free SHS? It's not going to be at the expense of the free SHS, which seemingly they really couldn't really address it well. But listening to both parties, and I think if you were in the conversation today, healthcare financing generally is something that came up strongly. And in fact, issues or challenges that had to do with the Ghana health insurance scheme, which most of us are aware of. There was one leveler, that is Dr. Abekan from the University of Ghana, actually clearly indicated, and I tend to actually agree with him, that it's about time we tend to look at the inefficiencies within the Ghana national health insurance system to make it attractive. It came up, and indeed the presidential advisor indicated that about just 12 million of Ghana's total population are actually registered on the health insurance. And the fact is, if you are not incentivized to register, you won't register. If I'm on a health insurance and I go to the hospital and the needed care that I need, I don't get it, issues of delays in payment or whatnot, I mean, I'm not going to be incentivized to actually even register to pay a premium. Also, even in terms of premium, we are told that as much as 60% or so are actually even on free premium, talking about the indigents, talking about children, talking about the aged, and so very small proportion are paying. And so it's about time we also look at holistically the health insurance system. So these are some of the key things that came up. And the last was issues with respect to immunization financing. Very soon, Ghana will be transitioning out of Gavi. And that means that we need to look internally to finance our immunization. You know that polio and other things are something that is really bedeviling the nation. And so the fact is that if Gavi goes and we don't have any means to finance it, what is it going to be in terms of polio eradication and other things like that? And so there was also this discussion around sustained immunization financing. So these are the key things that were discussed, and then the parties are actually looking at being committed to it. But then we live to see, because these still remain promises unless after the elections and then whoever wins power, whether it's the NDC or NPP, or in the event that even any of the smaller parties win power, that we need to really go to them again to tell them that yes, you are committed to A, B, C, and D in terms of health, whether really they are going to prosecute it. So generally, that was the discussion that came up today.
Sounds good to me. At least these issues have come up, and for the representatives of these parties on health, hopefully they'll take it in good faith and include it in their programs if they don't already have it, because very key issues have been raised here. The community health centers, for example, the CHIPS compound projects, which, you know, the people you have spoken to believe will do a lot of good if we focus a little more on it. Healthcare financing generally, inefficiencies within the national health insurance, and then immunization financing. These are very key issues, and I hope that some cues have been taken from there. Let's wrap up with what next after this.
What is happening is that we'll have a similar event tomorrow in the north. Okay. Today's event was basically to give those in the south the opportunity to interact with the two main political parties on their health manifesto. The same panel will be in Tamale tomorrow for the northern event. And so we would closely look at what the citizens in the north will be talking about, whether it will be border on the same issues or be different. But then after these two events, tomorrow's event, we'll closely still will be looking at engaging the political parties again to make sure that the promises that they've actually spoken about in their manifesto, when they win power, we'll go to them to commit to make sure that yes, there is budget pre-allocation. Because what we've observed from our budget advocacy work is that sometimes fine parties have very nice manifesto commitment, but then when it comes to implementation, they do not actually allocate budget or money for it. Sometimes, even when they allocate money for it, the issue is that when it comes to disbursement, they are not able to disburse as much. And so even issues of budget credibility and other things then comes in. So we will be on them, whether it's NPP or NDC, whether it's CPP or any of the political parties that wins power come December 7th. We're going to closely work with them to make sure that the issues that borders on